Hey, health junkies! It's time for the Health Fix. Join your host, Dr. Janine Krause, as she gives you a dose of what you need to know and do right now to take control of your health from the inside out, to rebel against aging, look damn good, fight stress, and laugh every day.
Hello, health junkies. Welcome to another episode of the Health Fix. I'm your host, Dr. Janine Krause, and today we're going to talk about acupuncture, and in particular, how acupuncture decreases inflammation and wear and tear on our bodies. Now, you might be thinking, well, I'm, not a sports person, or I don't work hard outside, but hey, guess what? Even sitting, driving, staring at a computer, texting, using your iPad, all of those different things cause wear and tear in our body. And the way these things do it is because we are literally kind of leaning forward. So there's a lot of wear and tear on the little joints of our neck. Yes, you have joints in your neck. Your vertebrae slide over each other. And so you have some joints there. And those guys are actually the ones that oftentimes cause trouble. They're called facets. And a lot of times these little pillar areas, if you want to think of it, where our vertebrae sit on each other, when we turn, we slide, or we sit in certain positions with our neck forward, which is usually the case in terms of staring at a computer, playing on an iPad or a tablet, or texting. We tend to lean forward and stick our chin out. So I challenge you to check yourself next time you do that. But nevertheless, those types of things cause wear and tear in our body. Sitting is actually probably one of the worst wear and tears on our body because a lot of us don't sit well. A lot of us kind of do a ghetto lean to the left or the right, or kind of lean on our elbow. And what that does is puts pressure on your spine and on your hip bones to one side. And so we've got a lot of wear and tear that we don't even think about that we're doing just in an everyday type of thing. Never mind if you have a certain sport that you play, or if there's a repetitive motion that you do in terms of work or things of that nature. So now, what I wanted to kind of get into here, because I get this question a lot from my patients, is what is acupuncture good for? And in fact, I think the number one thing to think about with acupuncture is that it is best for reducing inflammation. It helps, it's kind of one of the best anti-aging medicines out there. And we've got proof of this. So in 1991, yes, 1991, there was a Iceman found on the border of Italy and Switzerland, I believe. And the guy's name was Otzi. O-T-Z-I is what they're going to call him because he was found in a valley that has a name very similar to Oats, so O-E-T-Z Valley, and some German hikers found this guy. And he supposedly died in 3,250 BC, which is crazy. That's like insane. So that makes him 5,300 years old, making acupuncture quite possibly 5,300 years old or older, depending on who you talk to. And the reason being is because this guy, Otzi, was found with tattoo marks on areas that are common for wear and tear: ankles, knees, elbows, wrists. Think about your own aches and pains on a daily basis. In particular, he even had marks kind of by his Achilles tendon and his low back. And so these are all areas that we all, even in modern day, tend to have aches and pains at. So that being said, a lot of the research has looked at this individual and determined that these were probably really primitive marks of acupuncture and where acupuncture was being experimented with. So you have it right there that 3250 BC, folks were using types of acupuncture techniques. And so it's kind of cool to look at that and know that from his tattooed areas. Now, the other thing that they were looking at in particular with Otzi is that where these tattooed marks are, where the supposed acupuncture was happening, are like underneath them are wear and tear spots. And by that I mean, archaeologists can determine what individuals did for a living based on wear and tear of the bones. And when I say wear and tear of the bones, what I mean is that we develop thickenings on our bones where our tendons or ligaments attach into the bone. So let's step back for a second. Ligaments are attachments that attach bone to bone. Tendons attach muscle to bone. Now, when these guys go into our bone, they're going to, that's our anchoring, right? And one of the big things to think about here is that if we use a particular muscle more than another one, we create a stronger anchoring in the bone. The body naturally does that because it's going, oh, okay, this person's going to do that particular motion a lot. I better make sure that that attachment of that tendon or ligament is really strong there. So, for example, an archaeologist can find a body that's been mummified for thousands of years and can determine that, say, this individual worked hard labor. He was shoveling a lot. Why? Because his biceps, so the attachment of the biceps into the radius, so this is one of your forearm bones. It's actually the forearm bone. If you look at your hand and you go up to your forearm, it's the side of the thumb. That is your radius. And your biceps attaches in there. And so humans nowadays, if you're using your biceps, you're lifting, maybe you're shoveling, doing something like that, you might have an attachment that is stronger there. Now, what I'm starting to see is that if we are doing more in texting and we're doing more computer stuff, we tend to have aches and pains in a certain spot. A lot of folks have pains in the front of their neck or the back of their neck, like a base of the skull. Anybody have those where you rub and you're like, oh man, those ache? Or like halfway down the neck, on the sides, tops of the shoulders. What about those knots? All of those are related to leaning forward and kind of shrugging our shoulders up and rotating them forward, whether we're staring at a computer, whether we're texting, whatever. I'm also noticing that a lot of folks are starting to have finger and thumb pain, and in particular, pain in the forearms and pain in the digits and joints. Well, if you think about it, and you can even think back to your relatives and a grandma or grandpa, their hands look pretty gnarled by the time they got older, right? They had lots of nodules if they had arthritis in their hands. And what that's coming from is all of your digits. So wiggle your digits for a minute. All of your fingers have tendons that attach to them at the movable end. So kind of grip your hand, move it back and forth. Where you have little joints, where your finger bends, that's where you have a lot of tendon and ligament attachments. And those are typically the areas where they become gnarled and enlarged with age. Well, guess what? That's because your body knows that it needs to put some bones down there to keep things moving. And so, unfortunately, as we age, yes, we're laying down more bone depending on what we do for a living, but if we don't work on getting the inflammation out of those areas, we end up with really gnarled hands that tend not to work too much or too well after a certain age. And so our forearms have these muscles on them, and these muscles also have attachments higher up in your elbow. And if you wiggle around on your elbow, you might find some sore spots. And especially if you go to the outside and inside of your elbow. Those muscles are all of your texting, your computer, all of those little fine detail muscles. And those guys are biggies. The tighter that those muscles become, the more they pull on your hands, the more they pull on your wrist. And now you get wrist and hand pain. And so one of the big things that acupuncture is amazing for is that it can work to reduce the inflammation, and it can also reduce the tightness of those muscles that are pulling on those joints. So it works directly in the joint and it works directly on the muscle. So if we can relax that muscle a little bit, that tight muscle doesn't pull so much on the joint, and we don't get the body triggered to put too much effort into strengthening that tendon attachment to the bone. Because let's face it, our bodies will overdo things. And when they overdo things, we end up with bone spurs. We end up with issues in terms of calcifications. And bone spurs and calcifications equal decreased mobility, they equal pain, and they equal that we might even have tendon tears because of the bone spurs. Most common tendon tear in the human is the rotator cuff in the shoulder. And the reason being is because we do a lot with our arms, but our bodies are overinflamed in the shoulders and they lay down bone spurs. And those bone spurs end up tearing our tendons. So how do you get your body to decrease this inflammation and relax your muscles? Acupuncture is one of the great ways to do it. So what happens when you stick a needle into the body? Well, essentially you're sticking a needle in to tell the body, hey, bring some blood flow over here. It's really no different than if you were sewing and you poked yourself with a needle. However, it's not as painful because if you've ever sewn and you've poked yourself with a needle, usually you're going to poke it in the pad of your finger where there's lots of receptors and that hurts. Acupuncture shouldn't hurt. It should not be a painful experience. It should be a comfortable experience. I always joke with my patients, it's the most relaxed you'll be with a whole bunch of needles in you. And that's true. That's what should happen. So these fine needles, these are tiny needles. They are a quarter of the size of the needles that are going to be going in if you're thinking of a blood draw or something of that nature. Now, the needle goes in and the body has to respond to that because, like I said before, it's a wound. Most of our tendons and ligaments don't get a lot of blood flow to them. It's one of these weird phenomenons. We don't get a lot of blood flow there, so there's not a lot of nutrients to the tendon and ligament, but there's a heck of a lot of nutrients that go to the bone. And so if we can get more nutrients to the tendon and ligament, and we can get more blood flow to the tendon and ligament, the big key here is we can flush out inflammatory proteins. So our bodies, like I was saying before, when we have stress on a tendon or ligament in a particular area because we're using that area of the body or we're fixed in certain positions for a certain amount of time, our bodies are prone to work on the bone, but they're not prone to working on the tendon or ligament. And that's where acupuncture is amazing. So you stick that acupuncture needle in and you get the body to say, oh, okay, let's bring some blood. Now, if you leave the needles longer, then what ends up happening is we get movement of electrolytes. So sodium, potassium, even magnesium as a mineral moves in the third layer of the skin. Now, a lot of people will notice when they're having acupuncture that they might have a little itchy sensation, they might have an achy sensation, they might have an ants crawling type of sensation. I like to think of those as either A, the electrolytes are moving, or we're getting some histamines. Histamine is a natural kind of messenger that is going to say, hey, something's happening. And with histamine comes blood. So I always see it as a good sign if there's a little itching in an acupuncture site. Now, the ants crawling could be electrolytes moving, could also be a little bit of the histamines moving too. But these are all good signs. And typically you'll feel that during an acupuncture treatment. Now, sometimes the first time folks are a little kind of freaked out. Let's face it, someone's putting needles in you. That's kind of weird. We're not used to that. We didn't grow up with that. And so at first, sometimes folks might not feel as much or they might be a little more sensitive to the needles. But with time, those types of things wear off. And I have a lot of folks who, if they don't feel an ache kind of sensation, they're like, the blood's not moving, something's not happening. And honestly, you do want a little bit of an ache, but nothing that's uncomfortable. It becomes a good, relaxing ache. Now, the needles also stimulate endorphin release, and so, of course, we get a little giddy, a little happy. I call it acupuncture high. It's an awesome feeling, and so you get another benefit of that. The other big benefit of acupuncture is with that increased blood flow, with that increased sodium-potassium flow, you also get the flushing out of inflammatory proteins. And when I say inflammatory proteins, I'm talking about something called substance P. Substance P is a molecule that actually works to stimulate pain receptors. And in that case, the stimulation of pain receptors, it's actually a good thing to keep us out of trouble if something is life-threatening. But if they hang around because we don't have good blood flow in a particular area, then that pain becomes annoying. And it's something that isn't cool. It's irritating to the body. And of course, as anyone who's had chronic pain knows that it goes on too long and it's not serving a purpose. So getting back to acupuncture, why would we want to increase blood flow to an area that already hurts? Wouldn't we cause more inflammatory proteins to come in? Well, yes, that's true. But you also have a release of endorphins as well. And so in that case, it's kind of a 2-for-1 in which you have the flushing of the inflammatory proteins and then you bring in good new nutrients. Typically with acupuncture, I like to explain it much as it's almost like you've got a traffic jam in the spot that you have pain. Molecules are stuck there, your electrolytes are stuck there, and you just really need to flush it out. And then the body kind of goes, oh, okay, no big deal here. We just need to keep things moving. And so it's almost like creating a lane, a bypass around a traffic accident to keep blood flow moving. Which, by that being said, I do see mobility and blood flow and circulation, so maintaining that as you get older, really as one of the ways to the fountain of youth. but also the way to prevent your body from creating bone spurs and creating adhesions that lock up your mobility. Because the less you're able to move a joint, the more you're going to have pain, because your muscles will become fixed and your bones can become fixed. Your bones can really cause a lot of trouble on their own, because if the body feels it needs to lay down more bone in a particular area, that joint becomes fixed and becomes just stuck. If you've ever looked at someone who's older's knees, that's one of the things to pay attention to. You'll notice that the knees get quite large from inflammatory proteins, and the body just really triggering a lot of laying down of tissue. And so individuals who don't move very well, they're going to have larger knees because lots of inflammation there, lots of adhesions, and lots of the body laying down extra bone that doesn't need to be there. So something to keep in mind as we age. Mobility is key, blood flow is key, and acupuncture is one of the best ways to help keep blood flow moving in the body. All right, so what happens once you get an acupuncture treatment? So you're sitting there, you've got your needles in, you maybe feel that achy sensation, maybe you don't. What's happening? So ideally you want to think of it this way. There's about 14 highways in the body in terms of acupuncture channels. And I can access any of these, acupuncturists can access any of these points and use those particular points to help with blood flow. The other thing that an acupuncturist can do is look for a knot or a tender spot on the body and also needle that particular area. What I've found to be extremely useful to relax muscles and increase mobility in the body is to go after the trigger points. And a trigger point is literally a spot in a muscle that the nerve comes into, and it's an innervation area, so where the nerve goes into the muscle and can stimulate the muscle, but it's also an area that we have a whole bunch of a possibility for adhesions and knots. And when I say adhesions, I'm talking about, think about chicken. And you know how it's got that skin around, the very thin skin around it, holding that muscle together? We have the same thing. And our muscles are supposed to slide. That skin around it is supposed to slide on other skin around it. But sometimes we get so much inflammation in a particular area, then the muscle stops moving properly and those adhere together. Anytime we get adhesions and trigger points, that muscle doesn't work very well. And by that I mean we're going to have abnormal pull on the origin, so that where that muscle is attached to on one bone, and the insertion where it's attached to on another part of the bone. So for example, let's use one of our hamstring muscles. So our hamstrings attach at our butt bone. So literally like if you touch your butt, you've got a bone in the middle of your gluteal muscle in the butt. And that goes and attaches down to your lower leg, your tibia. And literally, if you touch from your butt and you go all the way down to behind your knee and just a little bit lower than where your knee bends, you're going to find some tender spots. And those are trigger points. And most of us have them because we sit all the darn time. And so our hamstrings become tight. Our calves become tight. And then we've got this battle between our hamstrings and our calves and the front half of our body, which is a whole nother story. I'll talk about that in subsequent podcasts. But in this case, when I'm talking about these trigger points, I oftentimes will needle the trigger points to help relax muscles and then needle the areas of wear and tear, which are usually going to be your origins or insertions of tendons. And in particular, even more so than that, it's oftentimes the insertion, because the insertion of a muscle is the movable end. And where our muscles move, we tend to have issues. So for example, if you want to take your hand and put it behind your earlobe and then slide it over a little bit, maybe like by 1 inch or 2 inches. Any pain in there? And if you can slide it down, if you know what your mastoid process is, slide it down there, it might be sore. That is the insertion of your sternocleidomastoid muscle. And guess what? And I'm saying insertion. It's actually the origin of your sternocleidomastoid muscle. It's where your neck muscle begins, and it comes down and goes down towards your sternum. Now, I want you to put your finger behind there, and I want you to touch. Might be sore. The other thing that you have there is that you have some of your neck muscles coming up there and attaching. So those areas are trigger points because that is the movable end for part of your trapezius muscle as it comes up. Now, I digressed about the sternocleidomastoid because I started telling you that mastoid process is part of the insertion. It's not. I lied. So let's switch that around for a second. Now, your muscle that comes down your neck and goes down to your clavicle, otherwise known as your collarbone, poke around your collarbone. Any pain along the collarbone, especially as you go towards the midline of your body and your sternum, those are all neck muscles. Those neck muscles are ones that we often use when we're leaning forward too much. So anyway, that's just a quick run through there. Now, another big one that can be an issue is if you go to the back of your shoulder and you feel on the top of your shoulder where that knot is, that guy there, that is where we've got a nerve going into the muscle and tightening that area up. So your trapezius, it could be part of your trapezius muscle, your traps, or it could be part of something called your levator scapulae, depending on where you're poking around on your back. And that guy goes all the way up to your neck. And whoo boy. So oftentimes, these ones on the top of the shoulder and up in the neck are one of the great spots where acupuncture can be extremely useful to help with neck pain or back pain. And so sometimes I'll have patients lying face down and put needles into the origin and insertion of the muscles and then poke along the muscle border, so the belly of the muscle, and see if there's any other knots in between. And I'll needle those as well. So that's kind of a combination of using trigger points, knots in the body, and the traditional channels, because there are 14 channels on the body in terms of acupuncture. And oftentimes, depending on what channels are locked up, that could mean what other needles that I might use. So, of course, the next question is always, how many needles do I use? Well, oftentimes I'm using somewhere between 20 and 30. It might sound like a lot, but hey, you got to do what you got to do to get things done. And so in that case, it's something to keep in mind that it can be absolutely important to focus on just not how many needles I'm putting in, but how you're feeling. And honestly, there are some theories out there where people don't put in more than 10 needles at a time. And honestly, if you've got aches or pains and you're working on wear and tear, that does nothing for you. You really want some help in terms of going right after those trigger points, because if you can get the muscles relaxed, you're going to have less pull on those insertions, so the movable end of the muscle, and the origins, the beginning end of those muscles. And honestly, I challenge you to play with kind of poking around on your body and see if you can figure out where you've got your spots that bug you, and see if perhaps you can just hold your finger on some knots and just kind of give yourself a little baby massage there and see if it helps with pain and helps with relaxing that muscle. You could also use lacrosse balls and things of that nature too, and then go out and find yourself an acupuncturist. All right, so once you get one treatment of acupuncture, are you done? You're good to go? I wish. Typically with acupuncture, I have folks doing series. And by that, I mean I will have folks do 2 treatments a week for about 4 weeks. Then after that, we break it down to once or twice a month. And then after a few months, I have people break it down to once every 3 months or so, kind of like a tune-up. And I really do like folks to think about anti-aging medicine and acupuncture almost as acupuncture being a monthly routine or every other month type of routine to help decrease inflammation in the tendons and the ligaments of the body and the joints too. And it's really a huge factor that's played a lot into my life in terms of being able to do the sports that I do. I am a huge advocate of getting out there and doing some sort of sport, not meaning that you have to compete, not meaning that you have to do anything crazy, just even walking. Just moving absolutely is key. Yes, I admit I am a CrossFitter. I push my body to the limits, but to be able to do that, I need to make sure that my blood flow is moving. Otherwise, yeah, I will get hurt. A lot of people talk about CrossFit injuries, and yeah, it happens. But you can keep yourself injury-free and keep yourself moving and feeling good with acupuncture. Same thing goes with all my runners. I have a lot of runners out there, and marathon runners and ultra marathon runners. You can keep yourself going if you maintain your body. Think of your body kind of like a car. I mean, we go and get our oil changed every 3,000 to 5,000 miles, right? How many of us go and change over our blood every 3,000 to 5,000 miles? Yeah, probably none of us. And when I mean change over your blood, I mean blood flow. Stimulate blood flow, get blood flow moving. Because circulation helps to decrease inflammation, and it decreases the body's wear and tear effects. It works amazing to do that. And so that's why I do a series to start. I really get the body, just amp the blood flow up at first so that the acupuncture, it's almost like your body needs to be primed to have acupuncture. And what that means is that the acupuncture treatments build on themselves. And so you're essentially teaching your body that, hey, these are the areas of inflammation. Hey, these are the areas you don't want to forget about. Hey, we need to move blood flow through these areas. And it's almost like once you get that system primed, it's all good after that. The next set of needles going in, the body goes, oh yeah, I know what I'm doing here. I'm going to work to get blood flow to those areas. Yeah, I got this. Our bodies are smart. They remember. There's a lot of muscle memory. And in particular, if you think of it this way, that memory is, if you have chronic pain, your body remembers where you injured yourself. It always is going to remember that. And so if you remember to help to flush out the inflammatory proteins in that area, the body remembers that it needs to flush that area too. It unfortunately sometimes can't do it on its own. And so that's where acupuncture comes in. It's really just a way to remind your body that, hey, yeah, I use these areas a little bit more. Or, oh, hey, I inflamed this area. I heard it a long time ago. We need to remember that blood flow goes through here. We need to get blood flow through here to keep us going. And so it's much like an oil change. It's a routine thing for maintenance of the body. Any of the high-level athletes that are out there, they're going to have regular massages. They're going to have regular treatments for their body. All of us who aren't, let's say top basketball players, top football players, major athletes, we don't even think about that. We just kind of go work out and then we're like, all right, I'm going to go home, I'm going to chill and go sit on the couch right after we're done or something of that nature. Really, to be able to have a body that's mobile for life and you can be out and about and walking and live your life to the fullest till 105 or whatever, you need to take care of your body and you need to work on maintenance. And so that's what acupuncture is. It's maintenance, and it helps you to keep circulation going. And so the biggest component of this podcast that I wanted to get across is that a lot of us think of acupuncture only as being necessary for a certain condition or necessary for pain, and then when you're done, it's done. Honestly, I see acupuncture as a way to increase longevity, increase your mobility, maintain your mobility, and maintain your body's ability to circulate blood. A lot of us, really part of aging is the decrease in blood flow to certain areas. Prime example is your face. You might have fine lines and wrinkles. One of the main issues with fine lines and wrinkles is circulation. And when I've used acupuncture regularly in the face, I've noticed that individuals that had certain deep creases or lines, those lines become less deep. Now, can I get rid of them completely with acupuncture? Heck no. But I can definitely work to improve tone in the face and work with circulation. Same thing goes for metabolism. A lot of folks ask me, can acupuncture help with cellulite? Well, it's not a miraculous type of thing, but it can definitely help in terms of getting blood flow to areas that the body forgot about. Think about this. If you have a particular area of your body that's really cold, like touch your thighs, touch your abdomen, especially if you have extra tissue, is that area warm or cold? Chances are it's cold, especially the more tissue that you have. Acupuncture helps to get the body to remember that tissue's there. Because the more overweight we are, the more tissue we're carrying around, the more the body basically stored stuff, and it's literally like your storage, container 20 miles away from your house or wherever. It's just like the body sets it in there and forgets it. And by putting needles in that area, it remembers, oh yeah, I've got that little bit of a hip over there. Oh, I should bring some blood flow through there. I should flush some stuff out. And so that's another way that you can think about acupuncture, and it's applicable component in terms of helping with overall decreasing inflammation, increasing circulation, and working to help with metabolism. Because if you think about all of these areas of wear and tear, the knees, the low back, your Achilles tendon, another common one, plantar fasciitis. A lot of us have inflammation on the bottom of our feet as we get older, and a lot of us have that because our calves are too tight. It's not the bottom of your foot that's causing problems. It's your calves are too tight, and they're pulling on your foot. The other big thing is your Achilles tendon that attaches into the bottom of your heel. If you have heel pain in the middle of your heel, chances are you've got some bone spurs because your calf muscles were too tight your whole life, pulling on your calcaneus, your heel bone. And so while it's difficult to get rid of a lot of those bone spurs, acupuncture can help to move the circulation in that area. So once again, going back to the wear and tear. But I can put all the needles I want in your heel. If I don't address your calf and release the calf muscles, because they're the problem, I'll get nowhere. So the idea here is to think about all the areas where you have chronic pain and then trace those areas back to where are the muscles at that are attached to those areas causing you pain. Those are the guys you want to target. So someone in this case could maybe make the argument that, well, acupuncture works, but what about massage for this? Oh, absolutely. I am a huge proponent of massage. And in fact, I think massage is amazing for keeping blood flow moving. It's great for helping with adhesions, so muscles that are stuck together. Cupping, I'll go into that in another detail, but cupping in the acupuncture world and gua sha in the acupuncture world is amazing. So cupping is the use of glass cups to suction to the body, but what it does is it pulls the tissue and helps to separate it that way, whereas massage is a push type of press in type of mechanic. And gua sha is a scraping, and it can get into some of the really, really fibrous adhesion areas. I use it a lot for scar tissue. So massage, cupping, those guys are really great. Gua sha really great for helping with keeping blood flow moving in particular areas too. And I highly recommend folks to do both. And the reason being is because cupping, gua sha, and massage are broad spectrum types of treatments that are going to work circulating blood flow in broad areas and superficial areas. Where acupuncture comes in is it gets in the deep muscle areas that you can't always get with massage. Also, it's kind of, as I tell people, I'm the cleanup crew. But the other detail here is that it's pinpointed, no pun intended, but it's focused areas. Because oftentimes in our body, if we go poking around, we're going to find pinpoint, pokey kind of areas that hurt. And massage can help briefly, but if you get a needle in there, that gets even more. So it's kind of like the body's drivenness or trigger to get the body to drive as much blood flow as possible to that tendon, ligament, insertion, origin, whatever it may be. And so something to keep in mind, plus with the trigger points with acupuncture, hands down, it's a great way to get in there and get those adhesions and knots broken up, but also get deep blood flow going. So acupuncture works on a little bit deeper of a level than massage or cupping or gua sha can. But by no means are either any of them not useful. I actually like to use them together because the combination of cupping, acupuncture, and massage is probably one of my favorite treatments. I also like the combination of gua sha, massage, and acupuncture too, or all four of them for that matter. So something to think about if you are noticing that you're starting to have aches and pains and you're eating clean and you're taking care of yourself and you're not drinking a bunch of alcohol, you're not doing a lot of caffeine, and you're going, I'm just not getting anywhere with the pain. Well, think about muscles, think about the insertion of those guys, and think about what you do on a daily basis. Anyone who is a desk jockey for work, you gotta have your ergonomic department come in and take a look at your positioning in your desk. I highly recommend stand-up desks, but here's the thing. Stand-up desks are really kind of no different than sitting ones in the case that now instead of just sitting for long periods of times, you're going to stand in the same place for long periods of times. So I'm a proponent of the desk where you're standing and you're wiggling around and moving at your desk. I do have the ability to stand at my desk in my office. Here at my home, I sit on a ball chair and I wiggle all the time because one of the other big issues of wear and tear on the body is sedentary positions and not moving, because that's just as much wear and tear as move, or overuse or repetitive movement. So something to keep in mind. And in particular, sitting and driving for long periods of times, these are all really hard on the body. We weren't made to have our body in a flexed position for days and hours and whatnot. So to sum things up, what I want you to think about is don't give acupuncture, don't discount acupuncture as just being something for an acute injury or something in the moment. It can be absolutely amazing to work to decrease wear and tear on the body, and almost consider it like a oil change that you would do for your car. It's like your tune-up. And I call it that for my patients too. I love the word tune-up because that's what it is. It's helping to keep your blood flow going. And if nothing else, it's working to get those inflammatory proteins out of your spots of wear and tear. So I highly recommend you go out there and find yourself an acupuncturist if you don't already know one. And if you have somebody that you're looking at, find someone that really understands trigger points and getting into the muscle, someone that is doing a sports acupuncture type of style, and maybe interview them a little bit and see what they have to say. Now, I also have some videos of myself doing acupuncture on patients in my office on YouTube, as well as on my website. I am very casual in my videos. They're raw videos. I'll be honest, it's me working on a patient who let me video while I was doing it. So they're raw videos, but I highly encourage you to check them out so you can see a little bit of what happens in an acupuncture treatment with me, and you can see all the ins and outs, especially if you've never had acupuncture before. So that is gonna sum it up for today, how acupuncture works on decreasing inflammation, and it just cuts that wear and tear on the body. And I highly, highly recommend you check it out. I've got some resources, of course, if you want to learn more about OTC and you want to learn more about acupuncture and its effects on the body. By all means, check out my resources at the end of my show notes. This has been another episode of The Health Fix. I'm your host, Dr. Janine Krause. Thanks for listening. Thanks for tuning in to The Health Fix, the podcast all about taking control of your health, rebelling against aging, and having fun every day. A lot of patients ask me, do you think I'm aging too fast? So, I created an evaluation checklist for you to see for yourself. Plus, I created a resource guide to help you slow down the aging process right now. You can find it for free on my website, drjkrausend.com. If you like this podcast, help get the word out to others by liking it and rating it. If you'd like more natural health tips and want to join our Facebook community where I interact daily, click on the Join Group button on our website at drjkrausend.com.